First question is, which of the following is the highest intellectual sensory area? That is Wernicke's area. It is highest intellectual sensory area. Lien in this will be patient will unable to comprehend the language, and in Broca's lien there will be broken words. Lymphatic drainage of anterior face and scalp goes to the submandibular lymph node. Now we will have to look at some. Okay, so as you can see, the lymph drainage from the anterior face and escape goes to the some different lymphatic drainage like submandibular glands. We will be looking at that image, but there is lymph node drainage from parotid gland, from tongue goes to the submandibular gland, submandibular lymph nodes, and sublingual and submandibular gland goes to down there. So in this way, lymphatic drainage goes down to these areas. And okay, so as you can see from anterior face, there are different lymphatic drainage like submental lymph nodes, inferior deep cervical lymph nodes, and superficial deep cervical lymph nodes as well. Now here we can look at different lymphatic drainages of the face and the scalp. So the last question was related to that. Lymphatic drainage from anterior face and scalp goes into the submandibular lymph nodes. Chromosomal abnormality was taught by Professor Son got a long bone deformity marker for suppressor of the long bone deformity is retinoblastoma 1. RB1 is long bone deformity suppressor. Next one is a patient has blindfolded asked identify a structure in the hand, which assessment is being done. That is superior parietal lobe. Superior parietal lobe and for patient's ability to combine touch, pressure and proprioception, and an ability to size loss of integrity sense, and for example eye closed individual is unable to recognize particular thing present, that is function of superior parietal lobe. Next one is a patient present with cardiac facial corneal defect, hypotonia, failure to thrive. Zellweger syndrome is there. Accumulation of long chain fatty acids. What fatty acids? Long chain accumulation and deficiencies per oxysomes and Zellweger syndrome. Now here we can see Zellweger syndrome, also known as cerebrohepatorenal syndrome, in which cerebral involvement, hepatic involvement, renal involvement results into paroxysmal disorder with white matter changes and abnormality in neuron migration, dysmorphic facial features, oliguria, hypotonia, cirrhosis, kidney disease, mutation in PEX gene results into short expectancy of these babies with facial abnormalities and all these kind of. Next one is a patient present with peripheral tingling, numbness, diplopia, visual disturbance diagnosed with demyelination disease. Type of nervous system affected are oligodendrocytes. Are this is the multiple sclerosis. This is the clinical presentation of multiple sclerosis. Increase in gastric emptying occurs with the help of gastric distension. When there will be gastric distensibility, increase in gastric emptying will be there. What is primary psychological changes associated with alcohol consumption? In alcohol consumption there will be decreased extracellular fluid osmolarity. Next one is lactic acid injection was given to the patient through IV line. It will cause increase in respiration rate because of chemoreceptors in medulla are there for maintaining body pH. Medulla chemoreceptor maintains the pH rate, increasing breath rate. A patient present with boils, perianal area, gland enlarged, boil eroding lateral wall leads to spread of that is rectal fossa. Now next one is mode is defined as most repeated value. Next one is a left circumflex artery occluded on angiography is noticed by doctor. Area will be which area will be damaged? Left atrium and left ventricle will be damaged because of Left circumflex artery supplies to the left atrium and left ventricle. So in this way, patient will have left side loss because of left circumflex artery damage. Next one is a girl spilled hot water, developed bully. What later developed erythema, fever, fluid in epidermis and dermis, leading to opaque redness, warm area. What type of inflammation is there? It is burn type serous inflammation. Serous inflammation. Next one is patient had injury of C5 to C6 vertebrae. Which nerve will be affected? That is C6. Patient present with chorea, mental retardation, hypotonia, memory decrease, depressed mood. Single gene inheritance disease, that is Huntington disease. Single gene inherited disease. As we can see, there is single gene mutation results into the chorea and all these type of mutated related problems. That is Huntington disease, in which patient will have neurodegeneration, atrophy and enlargement of ventricles, lateral ventricles, chorea, movement problems. That is Huntington disease. In Parkinson disease, there is deficiency of dopamine. In Huntington disease, there is genetical mutation. In Alzheimer's disease, there is deficiency of GABA. So these type of in Huntington disease, Alzheimer's disease, there is the GABAergic system inhibitory neurotransmission is disrupted, leading to variety of cognition and behavioral impairment. So Parkinson is associated with dopamine and Alzheimer's disease is associated with GABA. Next one is coronary sinus develops from left horn of sinus venosus. Cardiovascular derivatives are ductus arteriosus comes from ligamentum arteriosus. Left horn of sinus venosus gives rise coronary sinus. Foramen ovale give fossa ovalis. Allantois give median umbilicus ligament. Umbilical vein gives ligamentum teres, and notochord gives nucleus pulposus and eventually neural tubes. CSF flow blocked causing dilation of lateral ventricle leading to hydrocephalus, which is affected. Affected is intracellular fluid is affected, which results into cytomegaly. Another one is a patient has a neurologist stimulated locus coeruleus. Following neurotransmitter will be secreted from nucleus of this locus coeruleus. So neurotransmitters are norepinephrine. Basal ganglia release acetylcholine. Ventral tegmentum midbrain release dopamine. Nucleus ambiguous of basal ganglia release GABA. Locus coeruleus release norepinephrine and nucleus contains serotonin. This is very important chart to memorize that what kind of brain nucleus release what kind of neurotransmitters. Any affected part result into any affected part results into the certain disease, like as I already mentioned, dopamine inhibition, dopamine problem leads to Parkinson, GABA problem leads to Alzheimer's disease, gene mutation leads to Alzheimer's Huntington disease, and also there is serotonin related disorders as well.